Surgeries for ACL tear. Anterior cruciate ligament injury is one of the most common knee injury. Anterior cruciate ligament is one of the two major ligaments that cross in the middle of the knee, which connects the femur to the tibia. It helps to stabilize the knee. An injured anterior cruciate ligament may make the knee unstable, cause swelling, and can become too painful to bear the body weight. Anterior cruciate ligament injuries are common during sports and activities that can put stress on the knee, such as stopping suddenly, changing direction rapidly, slowing down while running, landing awkwardly from a jump, pivoting with your foot firmly planted, and receiving a direct blow to the knee or collision, such as a football tackle. The anterior cruciate ligament tear can be either partial or complete. In partial tear, the ligament is stretched until it becomes loose. In complete tear, the ligament is split into two pieces. Partial tears are rare. Most anterior cruciate ligament injuries are complete or near complete tears. Anterior cruciate ligaments are not usually repaired using sutures, because they have shown to fail over time. Hence, ACL reconstruction is opted, where the torn anterior cruciate ligament is replaced by a substitute graft made of tendon. Surgery for anterior cruciate ligament tear is recommended for patients who are involved in sports or have a job that requires pivoting, turning, hard cutting, or heavy manual work. If the anterior cruciate ligament tear causes significant functional instability, surgical treatment is preferred. Anterior cruciate ligament injuries combined with other damages to the knee are also considered for surgical approach. The different types of substitute grafts used for anterior cruciate ligament reconstruction are listed here. In the patellar tendon autograft, the middle third of the patellar tendon of the patient, along with a bone plug from the shin and the kneecap, is used. Some surgeons refer this graft as the gold standard for anterior cruciate ligament reconstruction. It is often recommended for high-demand athletes and patients whose jobs do not require a significant amount of kneeling. The advantages and disadvantages of patellar tendon autograft are listed here. For anterior cruciate ligament reconstruction, the semitendinosus hamstring tendon on the inner side of the knee is used. Some surgeons use an additional tendon, the gracilis, which is attached below the knee in the same area. This creates a 2 or 4 strand tendon graft. The advantages and disadvantages of the hamstring tendon autograft are mentioned in the slide. For quadriceps tendon autograft, the middle third of the patient's quadriceps tendon and a bone plug from the upper end of the kneecap are used. The quadriceps tendon autograft has some advantages and disadvantages, which are listed here. Allografts are grafts taken from cadavers. These grafts are also used for patients who have failed ACL reconstruction before and in surgery to repair or reconstruct more than one knee ligament. The advantages and disadvantages of using allograft are listed here. For the surgery, the patients may benefit from an anesthetic block of the nerves of the leg as it decreases post-operative pain. The patient's knee must be examined to verify the ACL tear and to check for other loose knee ligaments. The selected tendon must be harvested or thawed and prepared to the correct size for the patient. Small incisions must be made in front of the knee, where the arthroscope will be inserted. Bone tunnels must be drilled into the tibia and the femur. Then a long needle must be passed through the tunnel of the tibia, up through the femoral tunnel, and then out through the skin of the thigh. The sutures of the graft must be placed and the graft should be pulled into position. The graft must be held under tension while fixing it in place using interference screws, spiked washers, posts, or staples. The graft must be probed to ensure good tension and verify that the knee has full range of motion. Tests such as the Ligament test can be performed to assess graft stability. Some of the common complications of anterior cruciate ligament reconstruction are mentioned here. Surgical reconstruction of the anterior cruciate ligament has long-term success rates of 82 to 95%. Recurrent instability and graft failure is seen in approximately 8% of patients. Athletes may return to their activities after at least 3 to 4 months of sports-specific therapy.